Hello, everyone. I'm Dr. Kiran Mukku. I'm a consultant nephrologist and kidney transplant physician at Medicare Hospitals, High Tech City, Hyderabad. So today I would like to talk about edema. So edema means swelling of any body part. So that's a technical term for swelling. So this swelling can happen anywhere in the body. So it can be edema of the legs, it can be edema of the face, it can be edema of the abdomen in your stomach area, or it can be edema of only a single side leg, or it can be an edema of a single side or both sides hands. So most of the time we come across these swellings in normal settings. Like for example, if some injury happens any part of the body will respond by pumping fluid into that area. So that particular area of the body which gets injured becomes swollen because of pumping of the fluid water into that part of the injured body by the body as part of healing process. So that is one thing. Under normal or physiological setting, where we come across edema is pregnancy. So in pregnancy, most of the time we commonly come across women developing swelling of both the feet. So that is called pedal edema, and this is quite common in the later part of the pregnancy, where pregnant women develop pedal edema or swelling of the legs because of congestion, that is accumulation of the water in the legs. So that's the second most common setting where we find edema as part of a natural process. Coming to disease states, that is uh, patients developing, that is individuals who develop edema of the legs or edema of the face or edema of the abdomen because of some disease in the internal organs. So that is pathological edema. Most of the time, the swelling of the legs is quite a common symptom when we actually sit in OPD and treat patients. So, like I was saying, swelling of the legs is technically termed as pedal edema. So, pedal edema, uh, most of the time is because of some 4 or 5 causes. The first cause can be uh, kidney disease related. So the second cause is because of heart failure or cardiac failure can cause pedal edema. Third cause can be because of liver disease or liver failure. So it's commonly called as cirrhosis of liver, and the liver disease, liver failure patients can also have pedal edema. Apart from these three important causes of pedal edema, there are other causes of pedal edema like a local cause. Local cause means something's wrong in the leg. So as we all know that the blood flows through the leg, and the blood is brought back to the heart for pumping into uh, the other organs of the body. The blood has to come back to the heart. So there's a system called venous system wherein the blood is pumped back to the heart from the peripheries. So the legs also form the periphery of the body. So if there is anything wrong in this venous system, like for example, varicose veins. So varicose veins is a condition where the blood gets accumulated in the feet because there is no adequate flow in the venous system, wherein the blood is sent from the periphery or the legs towards the heart. So if that happens, the blood gets accumulated, and because of that, the fluid content or water content of the blood gets seeped into the skin and will cause swelling of the legs. So that is one of the important causes of leg edema, that is pedal edema. It can be single side or it can be both sides. So that was the fourth cause. Fifth cause is thyroid issues. So sometimes uncontrolled or uncorrected hypothyroidism patients also present to us with edema or swelling of the whole body. So, but then patients don't realize that they have swelling of the whole body. The only parts which can be seen properly is swelling of the legs or swelling of the hands. So when a patient comes with the swelling of the legs, we need to think about hypothyroidism or low thyroid function also. Apart from this, if there is any injury, if there is any problem with the lymphatics. So lymphatics is another system in the body apart from the blood circulatory system, which will transport lymph, which is rich in fats and other substances. So if there is a block in this lymphatic system also, patients can have pedal edema. So this is quite common in a condition called filariasis, where the swelling of the legs becomes so huge that it is sometimes referred to as elephantiasis. So these are the common causes of pedal edema. Among all these causes, kidney-related pedal edema is very important to discuss because in kidney failure or kidney disease-related uh, problems, the swelling of the legs comes first. So patients tend to present with pedal edema first. In heart condition, patients tend to develop pedal edema uh, and sometimes abdominal distension, sometimes swelling of the whole body as well. While in kidney, patients tend to have pedal edema as well as facial edema, that is swelling of the face also. So any patient coming with swelling of face as well as swelling of legs, we always think of kidney-related diseases. Liver failure patients, they tend to present with abdominal distension first. So water accumulates in the abdomen. Then after that, the swelling of the legs happen. So there is the order in which this swelling of the body happens can help us in deciding which organ is at fault. So once we decide that this swelling is because of kidney related thing, so it can be a kidney failure, it can be because of a protein leak. So that is there is a condition of kidney disease where the lot of protein gets leaked in the urine, thereby reducing the amount of protein in the body. So this reduced total body protein leads to swelling of the legs. So these are some of the very important causes of edema. So how do we decide whether, how do we decide whether this edema is because of certain kidney disease or heart related or liver disease? So certain tests needs to be done, like kidney function tests, urine examination, urine protein estimation, thyroid functions, then 2D echo, that is heart scan, to look at the function of the heart, to look at the pumping action of the heart, then liver function tests, blood tests, then liver scan, so ultrasound abdomen, which is the most common imaging modality, where we look at the kidneys, we look at the liver, and all other internal organs of the abdomen to look for cause of the edema. Apart from this, we always look at the amount of protein, total body protein, and serum albumin, which is the most common protein in the body. So, with these investigations, we'll be able to tell whether this edema is of kidney disease related, or heart failure related, or liver failure related, or thyroid related. For varicose veins, we need to do Doppler studies, that is a special scan to look at the veins of both the legs. So coming to treatment of edema, it is not easy to treat edema unless you know the cause of the edema. So edema is just a symptom. We need to understand what is the disease that is causing edema. So sometimes what happens is elderly women who have attained menopause because of withdrawal of estrogen support, they tend to develop pedal edema without any cause. It's just physiological edema. So even if you do a lot of investigations, lot of tests, we will not be able to come to a conclusion. So these when that is called idiopathic edema of the elderly. So it's very common among elderly women. So likewise, it's not easy to treat edema in certain individuals, although there are some medicines which will increase the urinary flow, so thereby excreting the excess water in the body through the urine. So they are called diuretics. So diuretics are commonly prescribed to patients with edema. At the same time, we have to understand what is the cause of this edema. If it is renal failure, it is cardiac failure, it is liver failure. Based on that, we have to take definitive treatment and edema will get cured. So this is all about the common causes. How do we investigate edema and how do we treat edema? Uh, and certain diseases, we need to reduce the amount of water we take, reduce the amount of salt we take in the food. These are general measures which will generally help us in reducing the edema. So this is something about edema. If you have any pedal edema or facial edema, please seek a physician's advice and look at the root cause of this edema and get it treated. Thank you.